Hey guys, in this video I want to talk about vitamin D toxicity. Now I think this topic's really important because I don't think in other videos, other articles I've seen that it really covers what's going on, but also gives you options on things you can do to avoid the toxicity in the future. And I'm going to share with you some things that I have done. I've made other videos before about why I no longer supplement with vitamin D. This kind of ties into that, so I want to hop right into it. So first of all, you need to understand how vitamin D actually works in your body. Now, there's no doubt vitamin D is critical to the overall health of your body. But historically, we get the vast majority of our vitamin D from sun exposure, sensible sun exposure. Now, the problem is we're so scared of the sun nowadays that leads to people opting for supplements. And that's where the problems start to arise. You need to understand it's called cholecalciferol. Okay, now that's made in your body from UV or radiation from the sun. Now, when that happens, you have enzymes that are actually in your skin that help regulate that process so you don't get a buildup of too much vitamin D. But when you supplement, because you're not relying on these enzymes in your skin, you can begin to run into problems, especially getting too much and seeing these signs and symptoms of vitamin D toxicity. Now, what happens when you supplement, you get too much vitamin D, the biggest issue that we're going to see is that you will get an increased absorption of calcium and phosphorus and sometimes magnesium from your gut, which can lead to some of these signs and symptoms. So what are those signs and symptoms of toxicity? There's a lot of them, but the big ones that you're mainly going to see, a lot of people will have a decrease in appetite that could come with nausea and vomiting. They can get confusion, muscle weakness. You may find yourself going pee more often. We see increased urination. You can become dehydrated and then you're thirsty. We can see heart issues. We can see increased blood pressure. We can see abnormal heart rhythms. A big one, this is very serious and rare, but we can see kidney failure. We can see pancreatitis. So I've mentioned supplementation. What is causing the toxicity? Why is supplementation a potential problem? Well, first of all, many of the supplements out on the marketplace don't actually contain the amount of vitamin D they say they do. Very few of them even get within 10% of what's stated on the label. And I've included a graphic, a table here, and I'll include a link to this study. And they basically can show, you can go down the line here. It's the stated dose on this supplement, for example, was 2,000 international units, which is pretty normal. But these people were actually getting 156,000 to 2.6 million units per day. Granted, that was only in one adult. But we can go down to other supplements. Here's one. The label said 1,600 international units, and they were getting 186,000. So you can see that you're getting these supraphysiological doses, much, much higher than your body would ever produce. You don't know it, and this vitamin D will build up. We'll see calcium levels go up, and then the problems begin to start. So supplements are a huge issue because a lot of them simply do not contain what the label says they do. Another issue is people taking supplementation into their own hands. I'm not down on supplements. I'm not pro prescription drugs because I'm a pharmacist, like a lot of people accuse me of. They've clearly not watched enough of my videos. But people take too many supplements that they don't really need. And then another problem is they'll take multiple supplements. You'll be taking a multivitamin that has vitamin D in it. You may be taking another formulation that has a little vitamin D in it. Then you're taking a vitamin D supplement that's just vitamin D, and you're getting way more than what your body can actually use, and you start to see the side effects we talked about above. Now, a good question is, okay, if you're experiencing any of those things, obviously you have the signs and symptoms we talked about. You do need to get your blood levels measured. A lot of people ask, well, what is the best level? I think a good level to shoot for is probably 60 to 80 nanograms per mil. Some will disagree with that, but that's a fairly good range. But if you get some of these symptoms of vitamin D toxicity, how long are they going to last? Here's another problem. Vitamin D has a really long half-life, and a half-life, in case you're not familiar, so the vitamin D half-life here is 2 months. So that means for you to cut the amount that's in your body down by 50%, or a half-life, takes 2 months. Okay, we say 4 to 5 half-lives to completely get it out of your system, but 2 months just to decrease it by half. So you can see that recovering from these toxicity symptoms can take a long time. Usually you're not going to see any improvement for weeks, okay? Is there a good option to kind of accelerate that process to get out of your system? In extreme cases, they can give you IV fluids. In less extreme, you can drink more water. In extreme cases, they can give people bisphosphonates, which are the drugs we give people if they have low bone density. Excuse me. So there are options, but by and large, you're going to want to drink more fluids. Another thing that people don't mention is you want to stay away from extreme diets, meaning anything that's going to eliminate carbohydrates, because carbohydrates, if you have a healthy metabolism and you're metabolizing carbohydrates, you will produce higher amounts of carbon dioxide. That's important because, as you can see here, carbon dioxide is required to dispose of calcium. Particularly vitamin D and vitamin K require carbon dioxide to clear calcium. Okay, so if you're on extreme diets, you're not producing as much carbon dioxide, it's going to be even tougher to clear that calcium. Now, where the rubber meets the road is, okay, what are the options? Well, you want to get back to what your body is designed to do, and that's to get sensible sun exposure. That's the best way to get vitamin D. Now, if you're like me, you live in an extreme northern climate, outside right now it's snowing. So you're not going to go out and get sensible sun exposure. What I do is I use a vitamin D lamp. I'll include a link in the description to the one I use. It's really simple. It's only a couple of minutes a day. Stand in front of that. It's not ideal, but in my opinion, in my experience, it's better than taking a vitamin D supplement where you run that risk. I'd rather give my body the raw materials it needs in the form of UV exposure and let it convert the vitamin D. Obviously, diet does play a role. We don't get a ton of vitamin D from our diet, but it does help. Like I said, the carbon dioxide thing, you want to use a sensible diet. So that's kind of vitamin D toxicity in a nutshell. I think being very, very careful with supplements. I'm not saying don't ever do it. For me personally, the juice wasn't worth the squeeze. I prefer doing it this way. I feel better using the vitamin D lamp during the winter months, summer months. I get sensible sun exposure. I have good vitamin D levels and I feel good. So that's how I tackle it. Let me know in the comments. You want me to cover any other topics? Let me know. If you've had any experience with vitamin D toxicity, in particular supplements, I'd like to hear your take. So let me know in the comments, guys. I will see you in the next one. Thanks.